again, Dr. Maya Kumar.
Thank you so much, Dr. Terrace, and Dr. Pavlovich, just thank you so much for that amazing talk. You're like a tough act to follow. I really enjoyed hearing it. Just a quick poll on the chat. Is everyone able to hear me okay? See the slides okay? Is that all good? Fantastic. Well, it's really a pleasure to be speaking at this conference again. By the way, I'm just curious if, am I able to advance my own slides? Is that an option? Hello?
I don't think so. I think.
No, okay, that's fine. I was just checking.
Maya, it's Meredith. Yes, you can, but you have to share your screen, and I didn't see you pulling up your slides, so I did it.
Well, I can do it.
Okay, I'll stop sharing, and then you can do it.
Okay, we good? Can everybody see this?
Yeah, looks good.
Sweet. All right. Thank you very much. So it took me like 2 weeks to come up with this title. And my husband thinks I'm super lame for being like, get it? Quarantine. But this is actually, in all seriousness, a topic that I have personally been seeing a lot of, and I think all of you are seeing a lot of, over the last few months, which is adolescents' mental health really declining and changing a lot, with all the events of this year so far. So just a few disclosures before we begin. So I certainly don't have any financial disclosures that I have, but I think that this is an area where we're in uncharted territory. And I have a psychologist friend who says that we're sort of building the plane as we fly it when it comes to helping people through the COVID crisis, and in particular with their mental health. Because we don't yet know just to what degree the events of the last few months will impact this generation of children and adolescents. We don't know the impact it will have on them in the short term or in the long term. So a lot of what I'm going to be talking about right now, over the next few minutes, is going to be more about what I'm seeing, what my colleagues are seeing, and in theory, what we should come to expect, knowing what we know about adolescent development. So I want to start by just going over my learning objectives for today, because I think that one of the key pieces that I hope you take away from this talk is that adolescence is a really critical developmental stage. It's not an age, it's a stage. And you're supposed to go through a series of very specific developmental milestones during your adolescence to come out on the other side being a functional human being who's an adult and able to contribute to society in a meaningful way. If you don't do that, if there's interruptions in that process, then the impact could last for the rest of your adult life. So I want to talk about how the inherent developmental vulnerability of adolescence almost lets us predict what some of the consequences of the last few months might be on them. I am hoping that by the end of this talk, you will know what are particular risk factors you should be looking for to identify kids who are at the highest risk of developing mental health problems during the current crisis. And I'm going to do that by sharing with you 5 kids who I have seen in my practice over the last 3 or 4 months, and whose progress I've followed, because I think they're all really good examples of those risk factors at play. And then in the last few minutes, we'll talk a little bit about some practical strategies for what kind of anticipatory guidance you can give your patients, how to screen for mental health problems, and what kind of interventions you can provide in your office in a practical way. So some of you guys may have seen a slide like this in some of my previous talks, but this is just a summary of the developmental milestones that adolescents are supposed to reach in order for them to become functional adults. So they're supposed to become independent from their adult caregivers or guardians. This is not to say that you would rather have eye surgery than be seen with your mom in a movie theater. It's having more of an adult relationship with your parents where you're able to take care of yourself while still having, a loving relationship with them. And in doing so, you can function in a world of your peers. You become more aware of your body in a way that children aren't. And you develop a sense of comfort, hopefully, with your body and all that it entails. You develop a sexual identity. You change your ability to think from very, very concretely to more abstractly. So if you ask like a 9-year-old, is it wrong to steal a loaf of bread to feed your family? It would be very typical for a 9-year-old to be like, yes, because stealing is illegal. It's wrong. So you should never do it. Whereas by the time you get through your adolescence, you might realize, you know, maybe it's not as simple as I thought. Maybe there are situations where somebody might do that and it might not be wrong. Or would it be wrong? I mean, they can see that there's gray areas. The adolescent years are when you really develop your inherent sense of what you think is right or wrong. Develop your own moral compass and develop a sense of purpose about what you want to do, what you want to be for the rest of your life. So this is a really critical time for these things to happen. And you can imagine that if something goes wrong, then your potential as a functional adult goes down a little bit with every one of these things that are compromised. So with that in mind, let's think about what the last 6 months have brought all of our teenagers. Boom. So let's start with shelter in place. We have shelter in place and social isolation during a time when our young people are supposed to be learning how to separate from their caregivers and care for themselves. They have less privacy, they have less opportunity to practice being independent, which means they're going to have less confidence in themselves, which is an important predictor for anxiety and depression. They're also supposed to be learning to fit in with their peers, learning to develop a support network that's not only rooted in their caregivers, but that goes broader, that goes beyond that. And now they're supposed to be socially distancing from each other. So somehow they're supposed to adopt peer codes 6 feet apart. Again, that often leads to very poor coping, increasing the risk for anxiety and depression. During a time when people are supposed to be developing a healthy body image, the only representation they have of bodies may be what they see on social media and influencers with highly modified images and very unrealistic depictions. With poor body image or anxiety and depression, that can snowball very quickly into disordered eating. Among young people who are supposed to be starting to explore their sexuality in a healthy way, they're trapped within the walls of their homes, which means they don't have as many opportunities for healthy sexual exploration, to, you know, talk with that cute person by the lockers and, you know, get a feel for things, to go to an awkward 8th grade dance and, you know, put your arms on somebody's shoulders like this and see what that feels like. So that curiosity doesn't have anywhere to go. And that can lead to sexual risk-taking, because the one thing shelter in place does not do is prevent you from having sex, I can tell you that. And it leads to vulnerability. It almost leads to wanting every opportunity you could possibly get. And you can imagine how that could run into some trouble. I will say that LGBTQ youth face a particular challenge if they're coming to terms with who they are and they do not have a social support network, or they do not have a supportive family, and they're trapped at home with a group of unsupportive people. The impact that could have on your mental health. You can imagine that if your capacity for abstract thought is sort of limited and you take what you hear and see at face value, that when you listen to the news these days or watch television these days, that the conflicting information you're exposed to will lead to a lot of confusion and or hopelessness. If you add on top of that the degree of disparity that COVID has really shone a light on among different racial groups, different cultural groups, different socioeconomic groups, not only does that lead to hopelessness, but if you don't know what to do with that anger, we have seen how it turns into violence. And lastly, when you have young people who are supposed to be figuring out their lives and their futures, we're closing schools, we're closing colleges, the economy is utterly collapsed, the job market is impenetrable? And how can we expect them to feel like they have a bright future ahead of them? So their inherent developmental vulnerability really predisposes adolescents in particular to poor mental health during this year that we've had. So with that in mind as sort of a background, I want to launch into some of the cases that I was referring to earlier. And so this is my first case, a 16-year-old named Shamika, who already, had a history of social anxiety. And before COVID, I'd met her maybe a couple of times, but her mom brought her into my office a couple months into the COVID crisis and said, I'm really worried about her because she's spending so much more time on interactive online games like Roblox and, which was something I'd never heard of until the last few months, and TikTok. Shamika taught me what TikTok is. So she was always, kind of into her phone and into her devices, but now it seems like all she wants to do. She's not doing her schoolwork anymore. She's supposed to do her household chores and she's not doing those. She used to have a little Etsy business making face masks, and she is not responding to orders and not following through on that at all. She hasn't been eating because she's not stopping her gaming to eat, and so she started to lose some weight. She's not brushing her teeth or showering very well anymore, and her sleep schedule is completely bonker sauce. She's going to bed at 6 or 7 in the morning and then sleeping in till 2 in the afternoon. It's gotten to the point that she doesn't even want to leave the house or talk to people even in the house. The family, used to attend church every Sunday, and so now they participated in online church services, but she didn't want to sit with them in that, even though that used to be a really important part of their lives. Things had gotten to the point that she was lying to her parents about her media use. Every time mom tried to take her phone or take her computer so she couldn't play, she would have an enormous meltdown to the point that mom was afraid she was going to hurt herself or hurt mom. When mom would successfully confiscate a device, Shamika, who would normally never do anything like this, would steal it back from the mom's room. The entire family was walking on eggshells, not knowing what to do about it. So the mom's question for me was, is she just another kid who's spending too much time on screens, or is this more than that? So this is the first risk factor that I want to emphasize, is kids who have pre-existing mental health condition. Shamika had told me in the past that with her social anxiety, social media was one of the only ways she felt comfortable communicating with people. Texting and social media were so much easier for her than talking to people in person. But she found that when she went to school, it was helpful because she could practice talking to people. Now that opportunity was gone. And she found that her degree of social anxiety, the idea of actually talking to someone, felt so much scarier. And so because she still craved the social contact, even though she didn't know how to do it anymore, she started engaging more and more in online interactions. The other piece that I want to bring up is there is a condition proposed in the DSM-5 called internet gaming disorder, which is essentially a substance use disorder. But if you replace the term substance use with gaming or online activities, it's essentially the same thing. It's literally being addicted to the internet or addicted to screens. And the symptoms of it, including like preoccupation with doing it, having withdrawal symptoms if your devices or gaming are taken away, needing to play more and more in order to feel satisfied, unsuccessfully attempting to quit, giving up other activities, deceiving family members, compromising your relationships or your schooling or your job for the sake of gaming or being on the internet. And the more people are forced to spend time on screens, the higher their risk is of developing this. So I told Shamika's mom, no, I don't think she's just another kid who spends too much time on screens. I think this has gotten to the point that her function has really been seriously impacted. And the interesting thing was Shamika actually said in my office, but I don't have a problem. I can stop whenever I want to, which was so painfully, ironic. And when I read out the criteria of this internet gaming disorder, she burst into tears and just said, maybe I have more of a problem than I thought. So what we decided to do was create a behavioral contract with intensive behavioral modification. we decided on rules where there were certain areas of her house where she could not have her devices with her: in the bathroom, at the kitchen table, in the shower. A lot of kids take their phones in the shower with them. During church services, and at a certain bedtime. We created a schedule for when she needed to do her homework and when she needed to do her chores. And it was only after she completed those things that she could get her devices and use them. And we talked about the need to rebuild trust between her and her mom, just like for someone with a substance use problem, that she would have to earn her mom's trust back. And if that meant starting off by locking the devices and gradually, having to do that less as she earned more of that trust, then that's what it would mean. They'd started seeing a therapist to treat the underlying social anxiety, and they're trying that now, but they're considering medication for the underlying social anxiety too. So in summary, Shamika, big risk factor, any kind of pre-existing mental health condition. And the more time you're on screens, the more you might see these instances of internet gaming disorder. My next case is Michelle, who's a 15-year-old girl whose mom said she had been depressed and sad for kind of a long time, like maybe 2 or 3 years, but ever since COVID started, she was barely eating. She was chronically expressing that she just didn't want to live anymore. She wasn't sleeping at night at all, and she was barely coming out of her room. She'd been on the wait list to see a psychiatrist for months, but there had been many issues. Once COVID hit, first of all, psychiatry availability became a lot less. This mom was a single mom with young kids at home who also had to work full time during COVID, so transportation was really an issue. And so when they did get appointments, they ended up having to cancel them a lot of the time. And the child herself was very reluctant to talk to me about it. And, our adolescent medicine clinic was offering telehealth. So the mom thought, well, maybe that's a good option that we could try. So I met this young lady, and she was initially very slow to warm. But after, even about 10, 15 minutes of talking, she seemed to warm up. She seemed to like the flexibility of telemedicine because she was able to talk privately from her own bedroom where she felt safe, and she could use headphones so that nobody could hear, what I was saying to her. And in the course of that initial conversation, she disclosed that she had been sexually abused repeatedly and recurrently by her grandfather and her cousin from age 5 or 6 until she was about 10. And ever since COVID began, she had started having classic symptoms of post-traumatic stress disorder. She was dissociating. She was having flashbacks to the abuse. She couldn't sleep because she was having nightmares. She was constantly on edge and startling really easily and having panic attacks. The mom knew about the abuse, and it had not been, it had been reported to CPS, but they had not really addressed the trauma piece. And the mom was completely devastated to hear that this was really what had worsened Michelle's condition so severely. On top of that, she felt that she didn't know how to help. Their income was limited. The wait list for trauma therapy was enormously long. And she said, am I a bad person for worrying that my dad, her grandfather, could go to jail? And it was such a complicated situation. And so my next take-home point is youth with a history of adverse childhood events, just like Dr. Pavlovich was saying, are a particular risk group. They're already really reluctant to seek care, to talk about bad things that have happened to them. And so in an age where in-person appointments are increasingly difficult and availability of appointments just in general gets much smaller, these kids will fall through the cracks and will be left to suffer alone. If you add on top of that kids who are currently being abused by the people they are sheltering in place with, and they don't have an opportunity to escape through things like school or going out to see a friend, then you can imagine how much more awful that situation is. And another risk group I want to mention are families who have fewer resources. And this is where telehealth could actually offer some flexibility and extra help that maybe we didn't use as an option as frequently before. Parents need a lot of support from you too, not just the kid. Sometimes that's practical support, like being referred to resources like 211, getting information about how they can file for unemployment insurance or get a stimulus check. But sometimes the parents need emotional support. And if you support the parent, then you're indirectly improving their child's mental health too. So with Michelle, I started her on an SSRI. I started her on an anti-anxiety medicine for panic attacks, and I started her on another medication for nightmares and her sleep. She's become so much more functional. She comes out of her room now. She started to do really well in school. She has a normal sleep schedule. We are looking to get her trauma therapy through the police. And we've established a good enough rapport that she's asked me, she has decided she wants to pursue a police investigation. She's asked me to be present when she does her interview with the detective. And so that's something I'm planning to do with her. And I'm truly, honored and amazed that we could develop this relationship over a computer. I have never met Michelle in person. And I'm doing a lot of talking with the mom too, to figure out how she can, it's perfectly okay for her to feel sad for her dad and also want to protect her daughter. So the next case I'm going to mention is a young woman named Maria, 18 years old, with a history of type 2 diabetes, so severe that she has to use insulin, and a history of a high BMI with depression. She's been in San Diego for about 4 years living with her dad, but before that she used to live with her mom in Mexico. With the onset of COVID, it was already hard enough for her to see her mom with any degree of frequency because she lived a few hours away, but she was unable to cross the border, and so was her mom. And so she hadn't seen her mom for months. Her diabetes was only diagnosed at 16. She had already been having a lot of difficulty coping with the disease, but now even making it in for appointments with their diabetes team was getting more difficult. And she used to kind of talk to the social worker in the diabetes clinic, but she wasn't really able to do that anymore. Her depression had gotten a lot worse. She was already on Prozac, but she stopped going to therapy because she couldn't go in person anymore. They were only offering virtual visits, and that felt weird to her. On top of all that, she was a high school senior. She wasn't sure what she wanted to do with her life. She wasn't sure how she felt about the idea of online college. She wasn't sure how she felt about the idea of working when her diabetes was so poorly controlled. She was coping by binging, and as a consequence, her A1C was through the roof, and her weight was rising quickly. So the next risk group I want to identify are youth with chronic health conditions, who even in the best of times often already have uncertainty about what their future will look like, negotiating those developmental milestones of adolescence while having a serious condition. They often, especially if they have parents who have kind of been the primary ones managing their condition and taking them to appointments and filling prescriptions and things like that, they may not have a lot of practice with kind of disease self-management or life self-management. They may be a little less mature in those regards than their peers. And so in an era where they have to kind of be more independent about getting the things that they want and meeting their goals, they may feel a little more lost. You all as providers are a big part of the support network that kids with chronic health conditions have. And if they can't access you because of limited appointments, because of only virtual visits that they don't feel comfortable with, then that's a huge, loss for them. And I don't have to tell anyone, at this conference about the strong relationship between your mental health and your physical health, and one goes down, so does the other. I also want to highlight as a risk group, immigrant and refugee youth and youth from border communities. If we thought family separation was an issue before, it's increased exponentially. And the sad thing is that while we used to hear about family separation and the difficulties that immigrant and refugee youth face in being apart from their families and in trying to better their situations, isn't it interesting how silent the news has been about those things when only a year ago it was something we would hear about every day? So their situations have really been completely dwarfed by the pandemic. On top of which, immigration cases have been dramatically slowed down in their review because of how clogged the courts are. So through frequent telemedicine visits, I talked a lot with Maria about, where we could go from here. And the first thing I did was increase her Prozac, which really helped her to kind of stop this cycle of binging and give her a little more motivation to try to take care of her health. She started improving her weight and her A1C got better. to make up for the lack of social support she had, I found a website run by the Juvenile Diabetes Research Foundation called type1nation.org, which is an online support site for adolescents and young adults with type 1 diabetes, but there are a lot of people with type 2 diabetes there too. One thing I thought was interesting is that her mom also has diabetes, but her mom would always say, don't worry, you know, we can do it. Everything's going to be fine. But I encouraged her to have a real conversation with her mom about, yeah, I know we can take care of ourselves, but it sucks sometimes. That has to be acknowledged. I encouraged her to make more standing dates with her mom and sister in Mexico. And I challenged her to think about how she could figure out what she wanted to do with her life. I referred her to Job Corps, which is a fantastic federally funded program that provides pre-vocational training for kids below a certain income to get her to look for a volunteer position or get a part-time job. And ultimately what she decided to do is to take a semester off to visit her mom in Mexico for a few months. She's going to start college in January, and she's planning on doing some babysitting or pet sitting in the meantime, just to kind of keep herself engaged. All right, case number 4, my friend Stephan. Stephan is a 17-year-old trans male who already has a history of anxiety and gender dysphoria. He had already been treated with a low dose of Zoloft for anxiety. And, you know, he came out about 3 years ago. He has supportive friends. Some of his siblings are supportive, but his mom still calls him by his old female name and uses female pronouns. He used to spend a lot of time out of the house with his friends. But then since COVID started, he had to stay at home with his mom a lot more and had a lot less access to his friends. Over the course of a few weeks, his sleep schedule became completely disrupted. He had no motivation whatsoever to do online classes. This was a fella who was already, you know, a little bit not keen on school, and the structure of school really made a huge difference for him. He was becoming more moody and irritable and got to the point that he was almost bedbound except for gaming to stay in touch with his friends. He started gaining a lot of weight. He started developing high cholesterol and high blood pressure, and his family was getting really frustrated with him. So as I mentioned before, LGBTQ youth are a really important risk group who may be spending more time at home right now with unsupportive family members and may not be able to access their normal support network. And the loss of structure that losing like actual school attendance in person has resulted in is critically disruptive. And so the very first step for a lot of these kids is getting them to eat and sleep and move again. And that's become my recurrent theme in talking to kids about you know, how to get their lives back on track. I think it's important to acknowledge, though, that for kids who are really depressed, the severity of their lack of motivation might prevent them from getting started with, you know, regular nutrition and regular exercise and a regular sleep pattern. You might need to treat them with medication or therapy first before they can get started. So I really, you know, started by trying to encourage Stephan to eat, sleep, and move. He tried, he made some progress, but he struggled to get beyond a certain point. And so finally we decided to try to treat his medication a little more aggressively. And then he became more amenable. And in the last 6 weeks alone, he's started going for daily walks. His BMI has come down. He has a normal sleep schedule, and he's looking into therapy through telehealth, which I think is fantastic. I'm going to skip the last case in the interest of time, but in summary, it's a case that some of you may have heard me talk about before. It's a 13-year-old girl who had a sudden decrease in her mood and started cutting herself. And her mom came to find that even though she'd really been encouraging her daughter to stay in touch with all of her friends online through social media and online games, she had been approached by an online predator who had been encouraging her to cut herself and to kind of engage in really dark thinking. And even after discovering this, the mom tried to limit her technology, but didn't take it away entirely. And the child actually ended up being approached by another online predator and another online predator. And finally, you know, the police became involved, and it was a pretty big mess. So the take-home point I want to make is that during this era, there's more supply of child pornography because kids are spending more time online, and there's more demand from messed up adults who are stuck at home and looking for that. So kids are incredibly vulnerable, and early adolescents in particular, who may not really understand the consequences of spending a lot of time on screen, who may be looking for ways to explore that developing sexuality and not recognizing when a situation is unsafe or where they might be being groomed. These are the kids that I worry the most about. So I'm going to end with this slide, which is just summarizing who is at greatest risk. And we talked about the first 5 already, but the last point I want to make is that every one of the kids that I talked about during this presentation was Black, Latinx, or a youth of color. And I think it's important to acknowledge that they, as a risk group, are at much higher risk of developing mental health issues in the climate that we're living in now, that has to be recognized and acknowledged. So for kids who are dealing with milder mental health issues, Eat, Sleep, Move is a great place to start. But for kids who need more than that, refer for therapy, refer for medication management. And just a plug for our new adolescent and young adults clinic at Rady Children's Hospital. We take all types of insurances, including Medi-Cal, and we do a lot of psychiatric medication management there too. So thank you all so much for your time and attention. I really appreciate it.